Welcome to the UCSF COVID-19 Response Town Hall. It's my pleasure to introduce Chancellor Sam Hawgood.
Thank you, Jason, and good afternoon and welcome to everyone. This has been truly an amazing week in our nation's history. Let me open the town hall by reflecting briefly on what has transpired. As we celebrate the legacy and leadership of Martin Luther King Jr., we can rejoice in taking a few steps forward to realizing his dream, that one day we will live in a nation where people will not be judged by the color of their skin, but by the content of their character. On Wednesday, we witnessed the inauguration of Kamala Harris, the first woman of color to become Vice President of the United States, a Bay Area native who shattered a glass ceiling that has existed for more than 2 centuries. We saw the swearing in of the first Latino senator of California and the first Black and Jewish senators from Georgia. As well, the Senate confirmed Lloyd Austin, the nation's first Black defense secretary. And we saw that we cannot take our democracy for granted after witnessing the deadly insurrection on our nation's capital. Within hours of taking office, President Joseph Biden took immediate actions to strengthen our standing in the world in several key areas. On immigration, President Biden bolstered the Deferred Action for Childhood Arrivals, or DACA Act, calling on Congress to enact legislation providing permanent status and a path to citizenship for Dreamers and other undocumented immigrants. He ended the Muslim ban that blocked travel to the United States, and he halted construction of the border wall with Mexico. On equality, President Biden's actions aim to root out systemic racism in federal agencies, removing barriers to equal access to opportunities, and to reinforce Title VII of the Civil Rights Act of 1964, that the federal government does not discriminate on the basis of sexual orientation or gender identity. On climate change, President Biden signed a letter to re-enter the United States into the Paris Climate Accords and reversed the anti-environmental policies on vehicle emission standards, drilling in the Arctic National Wildlife Refuge, and canceling the Keystone pipeline. On the coronavirus pandemic, President Biden unveiled a national strategy based on science, promising to be completely transparent, open, and honest, and addressing issues of health equity. Specifically, his administration is creating a national vaccination program to get supplies to community clinics and pharmacies as soon as possible, shoring up shortfalls in vaccines as well as PPE, in part by accelerating manufacturing through the Defense Production Act, increasing reimbursements to states for COVID-19 related expenses, and restoring global health security and biodefense at the National Security Council. He is also reinstating ties with the World Health Organization, naming Dr. Anthony Fauci as head of the US delegation. And I have to say, watching Tony Fauci on TV last night, he looked about 10 years younger. He is mandating masks on planes and urging all Americans to wear masks to prevent the spread of the coronavirus. We certainly at UCSF look forward to working with the Biden administration to finally bring an end to the COVID-19 pandemic. Tragically, more than 400,000 people in the US have lost their lives to this virus. It is a number beyond comprehension, and we extend our heartfelt condolences to everyone affected by this once-in-a-generation public health crisis. We hope that the national vaccination plan to administer at least 100 million doses in President Biden's first 100 days paves the way to vaccinating the entire country. Now, today you will hear more about our own vaccination program, as well as a new effort to offer drive-through vaccinations that began this week. In fact, today, you'll hear about that later in this town hall. In closing my remarks, as we face an uphill battle fighting COVID-19, we must double down on adhering to public health orders and UCSF's policies. Please do not get fatigued. Continue to wear masks, wash hands frequently, keep at least 6 feet apart from those outside your household, and complete the daily health screen before you come onto campus. Please be kind to those in our community working to enforce these policies to protect us all. We also need to continue to come together as one nation to heal from the discord that divides us and create a shared future. To quote from President Biden's inaugural speech, "Over the centuries, through storm and strife, in peace and in war, we've come so far, but we still have far to go. We'll press forward with speed and urgency, for we have much to do in this winter of peril and significant possibilities. Much to repair, much to restore, much to heal, much to build, and much to gain. So thank you for all you do at UCSF for our patients, our learners, and our community. And now it's my pleasure to turn the town hall over to Vice Chancellor Renee Navarro, who will moderate today's session. Over to you, Renee.
Thank you, Chancellor Hoggood. Good afternoon to everyone. It has been an amazing and historic week. We started the week honoring the legacy of Dr. Martin Luther King, whose words and deeds continue to inspire us to work for justice. We watched the inauguration of our new President, Joe Biden, and new Vice President, Kamala Harris. Vice President Harris is the highest ranking female elected official in our country's history, and the first Black and the first Asian Vice President. This is a remarkable achievement, and we should all celebrate. It has certainly been a long time coming. Another highlight at the inauguration, we heard from the Youth Poet Laureate, Amanda Gorman. She recited her inspiring and insightful poem, "The Hill We Climb." Amanda, another African-American California woman, is the youngest poet ever to read at a presidential inauguration. She reminds us, and I quote, "We've learned that quiet isn't always peace, and the norms and notions of what just is isn't always justice." President Biden has also issued an executive order that cancels the previous administration's ban on some anti-discrimination, anti-racism training. At UCSF, we are proud to launch for all members of the UCSF enterprise on coming Monday, January 25th, the UCSF Foundational Diversity, Equity, and Inclusion Training. But as the Chancellor said, this week's news hasn't all been good. The COVID pandemic has continued to rage with more than 400,000 lives lost in the United States. We mourn for these lives lost. The new administration has made the fight against the pandemic its top priority. President Biden has announced the goal of 100 million vaccinations in the first 100 days in office. We recognize the significant responsibility that UCSF has playing to facilitate the vaccination of our employees, our learners, our patients, and the general public. And we're currently in the midst of an intensive, complex vaccine rollout. You will hear more about that effort soon. With cases still surging and the disproportionate impact of COVID on Black, Indigenous people of color, it is critical that our efforts also address the vaccination hesitancy that we're seeing across the country, across the state, and indeed here at UCSF. Our numbers show that fewer of our Black and Latinx colleagues, when invited, are activating and making vaccination appointments on the UCSF's online patient portal, MyChart. There are a myriad of reasons for this, but we cannot ignore that for some members of our community, the idea of a vaccine is fraught, and there are significant historical reasons for vaccine hesitancy. As an institution, we need to validate the traumatic experiences and lack of trust of our colleagues and patients. And as caregivers, we're taking a trauma-informed approach as we reach out to all communities to provide additional information, answer questions, and address concerns. While we cannot erase the US history of medical exploitation and exclusion in clinical trials of Black, Indigenous, and other people of color, I and other faculty members are teaming with the Black Caucus, the Black Caucus Oakland, the Chicanx Latinx Campus Association, and the Latinx Center of Excellence to engage and assure that communities most impacted receive the information they need to make fully informed vaccine decisions. You should know that according to the CDC, the first 2 messenger RNA vaccines approved by the FDA for emergency use authorization from Pfizer and Moderna were tested in a diverse group of people. About 30% of the US participants were Latinx, African American, or Native American. About half were older adults. There were no significant safety concerns identified in these or any other groups. The following video depicts the science of the messenger RNA vaccines developed after decades of work in this field. Please play the video.
The first 2 vaccines approved to combat COVID-19 are the first medicines of any kind based on mRNA. Conventional vaccines contain dead or inactive virus particles, but mRNA vaccines work differently. mRNA is a bit like an instruction manual. Virtually all the cells in our body use mRNA to build proteins. In the new COVID-19 vaccines, mRNA carries instructions for building a copy of the spike protein, the part of the virus that attaches to our cells. By itself, the spike protein is harmless, but it trains the immune system to fight the actual virus. But mRNA is fragile and breaks down quickly. To protect the mRNA long enough for it to reach a cell, scientists wrapped it in a protective bubble called a lipid nanoparticle.
RNA is very susceptible to being digested by enzymes called RNases. And so the lipid nanoparticles protect the RNA and help deliver the RNA to the inside of cells. If RNA is lying around outside of cells, it won't get turned into a protein.
Because mRNA breaks down at room temperature, the vaccines need to be kept extremely cold. These new COVID-19 vaccines represent the culmination of decades of research into mRNA medicines. mRNA-based drugs have potential well beyond this virus. They are now being developed and tested to treat a wide range of diseases.
So while these vaccines are new, the science behind them is not. Now we'll hear from Gina Intinarelli, Vice President of Population Health Management, and Susan Smith, Chief Faculty Practice Officers, both of UCSF Health.
Great, thank you, Renee. Let me just pull up my slides. Okay, good afternoon, UCSF colleagues and community. Happy to be here to give you an update on our vaccine program. Also wanted to thank and acknowledge everyone in the UCSF community. So many of you have volunteered to help in the vaccine center, and we couldn't do it without you. So very grateful for your putting your heart into this and helping us through a very big effort. UCSF should be proud that we are leading in our community in so many ways in the vaccination effort. First, we'll start with our overall progress. So as of the end of the day yesterday, we have delivered over 25,000 doses. This is 18,914 to healthcare workers. First dose is the blue line. The orange line represents our second dose cumulative total to our healthcare workers. And the gray line represents our patient vaccination, which we began last Friday for our over 75-year-old patients at UCSF. The populations that we have vaccinated to date are our healthcare workers, over 18,000 UCSF in phase 1A. We have partnered with the city to offer vaccines to healthcare workers in the city who work in community or private practices that need access to vaccine. These are frontline healthcare workers, and we have vaccinated over 800 as of last night. We have vaccinated over 1,700 patients age 75, and we have a total of, between being vaccinated and scheduled, close to 5,000. And you'll hear more today about our mass vaccination center that we opened, but we anticipate vaccinating another 1,100 patients over 75 today. We want to be very transparent about our vaccine supply. And this is just a graph that basically shows the different deliveries that we had of vaccine. As you can see, they come in different dates and times, and then certainly different amounts, and how quickly we're able to spend these down and get vaccine into arms. We do have tranches that are earmarked for second dose, and those are part of the overall calculation. Here's a timeline. I know many of you are asking, when is it your turn? When will my patients get vaccinated? We are, again, balancing vaccine supply and capacity. So as you can see, starting at the bottom, we started on 12/16 with our frontline 1A healthcare workers, and we continue to vaccinate anyone who identifies in that category. On 1/15, we opened up to our patients and employees who are 75 years and older. On 1/19, we began vaccinating our community healthcare workers. We anticipate that sometime next week, we will be able to open up to our patients and employees over age 65. And shortly thereafter, we should be able to follow with our UCSF on-site essential workers and our UCSF patient essential workers. In a future date, we will be able to offer to people between the age of 50 and 64, and any patients with comorbid conditions who are younger than that. And now I'll turn it over to Dr. Susan Smith, who will finish off the rest of the presentation.
Thanks, Gina. And thanks to all of, adding my thanks to everybody who's been participating. It turns out that this is, of course, a massive operation to get all these vaccines in arms. So I thought we'd pick up with, Gina's shown you where we are in vaccinations and where are we headed. At Parnassus, we'll continue to vaccinate for the next bit of time here, at least. We're going to focus on UCSF employees and the San Francisco healthcare workers that we've been vaccinating at the request of San Francisco Department of Public Health. There will be some second dose for employees when those are due, and we put in as many first doses as we can afford to put in the space, and given the vaccine supplies, which right at the moment are really good. And the capacity goal that we'd like to get to at Parnassus is probably around 1,000. We have to do some logistical changes to get to that number. At Mission Bay, we're going to focus our efforts there for patients. We're currently vaccinating first dose and older patients, older than 75. We'll, of course, give second doses when that's available, same target of 1,000. And we are hoping and planning to move to the Rudder building on Tuesday next week, which will make it much easier for, I think, everybody, and much more capable of getting to the 1,000 goal that we would like to get to. In the East Bay, they're vaccinating second dose for their employees when they're due. That's what they'll be doing most of this week. And we're discussing what else can we use the Oakland facility for, including maybe community healthcare workers. So that is to be determined. They vaccinate around up to 200 people a day. And then City College, which you've heard about, it went live today. Next slide. Thought we'd give you just a overview of what does that site look like. It's a big site. There are, I think, 8 lanes that we're delivering vaccine in. Next slide. And you can see people come in, go through their lane. That's quite an operation. There's a golf cart delivering vaccine to each of the stations. And I think the weather has been somewhat problematic there, just as it has been at Mission Hall today. We were worried all morning whether we'd fill up and actually get to the target. We not only filled up, but we exceeded the target. Dave Morgan and Sheila Antrim and Eva Turner and Sasha Mordekowitz McKinsey have been instrumental in this effort. Dave just called me to tell me that they expect to get 552 doses in today. Our hours there will be from 8 a.m. to 4 p.m. We're working with the city, with San Francisco Department of Public Health, with Dignity, and with One Medical at that site. And eventually we hope to ramp up to maybe as many as 3,000 a day. We need to see whether with parking and traffic control, we can actually make that. The scheduling is a little different. For City College, we're using Eventbrite with the city. The staffing at the moment is UCSF. Thankfully, we have San Francisco Police there to help support and direct traffic. Next slide. Many people have asked us about what kinds of reactions are we seeing to the vaccine. This is what we've learned from our occupational health data. Mostly pretty minor skin reactions, some feeling fatigued, not feeling well, lightheaded, several vasovagal episodes, and some things that are just difficult to classify. We've had to use Benadryl a few times, epinephrine only once. We've sent 3 people to the emergency room, and I believe all of those people did fine. Next slide. We also hear and see emails about a variety of other concerns that we wanted to address. So one concern was, were we wasting slots? Were the slots going underutilized? We opened to patients a week ago today, and we did open with much smaller volumes than we had been with vaccinating employees. That turned out to have been a really good decision. The patients who came who are age 75 and older moved somewhat more slowly. So we need a little bit more time to move them through the vaccine center, which is not in a car. This is not the drive-through. This is our Mission Hall site. And almost always they come with someone else. So the social distancing issues become much more significant when we have 2 or 3 or 4 people accompanying a patient. And sometimes those people are actually necessary to go through the whole process. We ask anybody who can wait outside to wait outside, but sometimes the accompanying helpers need to actually go through. We also have a variety of testing scheduling tools that we need to do. We've been using MyChart, what's called ticket scheduling. There's some parts of that work great, but we need to avoid crashing the MyChart mechanism, which we've done a few times, and clearly we want to avoid crashing Apex, which is our electronic medical record. So we're continuing to do some testing of what's the best scheduling methodology. So we feel like we've maximally used the slots that have been safe to use. And as Gina referenced, now that we've learned how to manage the older patients, we think that between City College and Mission Hall today, we will have vaccinated around 1,100 seniors. So we're learning. People have been concerned about whether we're wasting vaccine. The data that we know about is that we think we've aged out on 3 doses out of the 25,500 that we've administered, and that the overfill that we've gotten from the vials that our pharmacists have been really doing a great job drawing up far outweighs the 3 lost doses. Those doses generally there's a struggle sometimes at the end of the day when you have to draw up an entire vial and you don't have that many patients. And we've worked on a variety of schemes to make sure we have enough people available to fill those doses in case we have extra doses at the end. We've heard concerns that there's not enough Pfizer for the second dose. And that is not accurate. We have plenty of Pfizer for the second doses. We actually currently have 500 slots open for second dose scheduling. Remember, there's a fairly wide window. We advise not to get the vaccine before 21 days, but you can vaccinate after that 21 days. So people shouldn't worry about it. If they haven't been scheduled and feel that they should be, please email the COVID vaccine at ucsf.edu and put Pfizer dose 2 scheduling in the subject line. We've heard a lot, which I love, about UCSF, a lot about reaching vulnerable populations and why did we focus on MyChart. So to be clear, we focused on MyChart for patients first because we actually got to the patient level a couple of weeks before we thought we would get there. So we did not want to waste slots and not schedule people. And the quickest thing that we could do and be aligned with the CDC and CDPH recommendations was to use the MyChart. That said, as Renee talked about, we're working on, we've looked at the disparity analysis and we are putting strategies in place to deal with that. We're also partnering to conduct some home delivery for elders that can't get out of their house. And we're going to engage with patients who are not on MyChart, and I'll talk about that in the next slide. Lastly, some communication issues. The COVID vaccine email, we know we've been slow on it, but we're engaging additional help to manage that. We're also setting up a patient vaccine hotline because we know we'll have lots of questions that need answers, and we're trying to not dump a lot of work onto the clinics that already are quite busy. We will be, as we make changes and update what we're doing, we'll be using the email blasts that we have done periodically and updating the website as we do that. And we're also working on improving our dashboards, a dashboard for patients, ongoing patient vaccine, employee vaccines, which to date have just covered phase 1, and also a dashboard to show our vaccine supply. Next slide. So I want to talk for just a minute about the patients who are not on MyChart. So we certainly recognize that there's a subset of patients who don't have a way to receive our emails. They either don't work in or live in email, and they would have difficulty either receiving the email or activating the MyChart. And largely these are at-risk and vulnerable populations, and they would be we know that they will be overrepresented in this group. The goal is to reach out to those patients who have technical and language barriers and to work with Renee's team to understand and be effective in the group of people who have vaccine hesitancy. We'll offer MyChart and scheduling support, as well as a helpline phone number for those who are having technical problems. And we're also going to segment a small number of vaccine slots, appointment slots for those that we are having, those issues, that when we get them on the phone or on MyChart and can help them schedule, that we actually have an appointment to get them into. We're also looking at different modalities. So some people can be accessed by email, but we'll also use mail and text messaging. And for those who really just need a phone call, we're figuring out how to do that. Next slide. So communication is almost always one of the most difficult parts of any project, and we appreciate everybody's patience as we try to get it right. We know that we never send out enough communications, and they never have everything in it that everybody wants to hear about. I wish we could do it better, and we're trying continuously. But please go ahead and send your concerns and troubleshooting requests to the COVID email box there. Include the name, employee ID number, date of birth, phone number, and email so we can get back to you. It will take about 48 hours. And there's also the MyChart activation desk phone number posted there. Next slide. Just thought we'd end with another shot from City College and one of our patients this morning getting their vaccine. Thank you so much. Happy to take questions at the end.
Thank you very much, Gina and Susan, for your presentation, and to you and your teams for your skill and your expertise in overseeing and implementing this critical solution. Thank you. It's been amazing to watch the work being done. Next, we'll hear a global COVID-19 pandemic update from George Rutherford, Professor, Epidemiology and Biostatistics, and Director of Prevention and Public Health Group. George?
Thank you so much. It's great to talk to everybody again, and happy end of the week, and a remarkable week it's been. So far, as of today, there have been almost 25 million cases reported in the United States. As you can see, we've turned a corner here. These don't pay any attention to these little divots. These are from holidays, but we're starting on the downslope of this third wave of the epidemic. There are major outbreaks that persist in the South, Southwest, and Mid-South, but cases are down in 36 states. However, Hawaii remains the only state not surging or recovering from a surge. I've said this before, but I wanted to repeat it again in this forum, that COVID became the leading cause of death for the month of December in the United States, ahead of cancer and cardiovascular disease. And on 7 days in December and on 11 days so far in January, there have been more deaths in the US from COVID than there have been from cardiovascular disease and cancer combined. And you can see we're running kind of roughly at about 3,000 deaths per day, which is a lot. Here you can get this sort of general swath of kind of the Mid-South that you can see as a more infected, and then clearly out here in the West, including places like, Nome, Alaska. In California, we also, I think it's fairly safe to say that we've turned the corner and are coming down on this third wave of the epidemic. There have been 3.1 million cases with more than 25,000 yesterday, and we're sort of running roughly at about 30,000 cases a day, which is an enormous number. And here you can see that there were 735 deaths yesterday, and we're running roughly at approximately 500 deaths per day. Here you can see in Los Angeles, in Riverside, kind of in San Bernardino, in San Diego, and maybe in Orange, but clearly in Los Angeles, that we're now starting to enter the down slope of the curve. I would caution you that this is most likely that this is a lot of naturally acquired immunity that's going on here, and with 1 million cases, Los Angeles probably has, a background level prevalence of immunity of something roughly on the order of 20%, if you believe there are twice as many infections as there are reported cases. Overall, the state has an effective reproductive number well under 1 of 0.87. The test positivity rate is at 9.3%. It's fallen 23% in the last 7 days. Statewide, the number of cases is at about a little less than 80 per 100,000, which is still enormous, but has fallen 30% in the last 7 days. Hospitalizations are down below 19,000, which is a 13% decline. The ICU capacity, which this is I think is kind of a misleading way to phrase this. This means that that 60% or more of ICU beds are filled with COVID patients across the state. But that's what 0% means of this metric. And the deaths are even starting to fall at 1.3 per 100,000, which is a 6% decline. And here you can see the ICUs. The total hospital admissions coming down. Even the ICUs are coming down, and the positive rate is coming down. So that leads us to our new nemesis, this British variant, the B.1.1.7 lineage. There have been 144 cases that have been detected through yesterday in the United States. 40 of those are in California. The bulk of these are in San Diego County, in the sort of eastern suburbs. For those of you who know San Diego, this is El Cajon, Santee, Lakeside, Spring Valley, La Mesa, those kinds of towns. There are 46 in Florida, and the rest are fairly, except for 17 in New York. It's spread fairly widely. So this is of concern. with this new variant. The concern is that, first of all, it's more transmissible. It adheres better to the targets, and so that it will gradually replace the current strains that we have. These are CDC models that would suggest that it will replace the current variants kind of roughly in April. This is with a reproductive number of 1.1. This is with a reproductive number of 0.9. I think that this is probably a lot more likely scenario given the background amount of naturally acquired immunity, which still works just as well against this variant. But nonetheless, we'll be dealing with it into the future. There was a report in the Boston Globe that said that this was a more deadly strain, which is, I think, originally came from Boris Johnson, if we want to get back to what the root causes are. And I think to the extent that it causes, my reading of it is, to the extent that it causes more cases, there will be more deaths, which is, yeah, okay. But I don't know that anyone's been able to show that the mortality rate is any different with this strain than with other strains. I thought it'd be helpful to touch on the vaccines we're likely to see coming down the pike. This is the AstraZeneca vaccine, which is an adenovirus vaccine. It's already been authorized in a number of countries. And so this is the chimpanzee adenovirus, and it's 2 doses, 4 weeks apart. And this has a lot of stability. And I think it's going to be kind of the major, a major source of vaccine for countries like Mexico that we should take a very close interest in. Novavax is a Massachusetts, I'm sorry, is a Maryland company. This is 2 doses, 3 weeks apart. This is in phase 3 trials in the UK and the US, and this is a protein vaccine. They're just injecting the spike protein on a nanoparticle. And then J&J is another adenovirus vectored vaccine. This is the same adenovirus that's used for Ebola vaccine. This is a single dose, and it's it's got reasonable storage parameters, and can be actually refrigerated for up to 3 months. There's a phase 3 trial in the US, which started in December. And there's also another phase 3 trial that's comparing 1 dose versus 2 doses. This has been pushed. This has been, the buzz is that this is a single dose administration. And then enter the Biden administration. This 200-page document was published yesterday. I'm almost through it. Sorry. But these are the chapters and these are the points. Restore the trust with the American people. Number 1, found a safe, effective, and comprehensive vaccination campaign, mitigates spread. I'm sorry. This is what happens when you write it directly through expanding masking, testing, data, treatments, healthcare workforce, and clear public health standards. Expand the Defense Production Act. Safely reopen schools, businesses, and travel while protecting workers. Protect those most at risk and advance equity, including across racial, ethnic, and urban-rural lines, and restore U.S. leadership globally and build better preparedness for future threats. And I'm pleased to note that one of his President Biden's first executive actions was to rejoin the World Health Organization. So I'm happy to answer questions going forward, and thank you very much.
Thank you very much, George. President Biden has been quite busy. Now, Ralph Gonzalez, Associate Dean, Clinical Innovation and Chief Innovation Officer for UCSF Health, will give us the local update on testing and new cases. Dr. Gonzalez.
Thank you, Renee. It's good afternoon. It's a pleasure to be here. I'll give you a quick update on, George kind of gave you a sneak preview, but I'm glad to say that we're seeing some similar trends here at UCSF. This shows you our weekly COVID cases among all of our staff, employees, and students, showing you weekly numbers since the beginning of December. Cases each week running in the 70 to 80 range. And that continued with our highest peak the first week back of the new year, almost 90 cases that week. And as you can see here, last week, we actually decreased to about half of that number. And then this current week, so far, we're even less than half of last week. And so this is very exciting to see. If you look at our asymptomatic COVID test positivity rates using our color system, I think it also tells a good story if we think asymptomatic positivity is sort of our background rate of infection that's going undetected. Here you can see it going up throughout December into January, and then we saw a major drop last week, and we haven't had any cases this week. So another good sign. I do have some data to show you on some of the demographics of who's getting the COVID cases and the distribution of those in the new year. This shows you in the primary work area, the large majority have been in the health and clinical work areas, 28 cases in research, and then the other cases were in admin and management areas, oftentimes off-site, not actually on our main campus. If you look at job groupings, the line share is in admin and management. That can be across both UCSF Health or campus and research, support services, nurses, and some of our other smaller professional groups. But if you actually look back at some of the previous town halls, we saw larger numbers of nurses, larger numbers of residents and physicians and allied health. These took up over half of the pie in previous analyses. And so I do think we're starting to see some shifts, and that could be a vaccine effect. I think if we look at exposure source, it even looks a little more titillating. If you look at December, during that 300 case month, the large majority continue to be roughly 2/3 still are community acquired. Among those that are likely occupationally acquired, the majority are among people who participate in direct patient care. Indirect care is shown here in gray, and then there were 10 coworker to coworker transmissions. And so I want to underscore this point that to have a reproductive number of 1 means that if we had 300 cases of COVID in our workplace, that we would need to spread that to another 300 people to get a reproductive number of 1. And so the fact during this major surge month, we only saw 10 coworker to coworker cases, transmissions, I think again says that for the most part, our work environment continues to be very safe and calls for more aggressive mass screening and testing is not going to have a dramatic effect on reducing this number further. But getting back to the real story here, if you look at our case now, we've only been able to adjudicate about half of our cases in January so far, but as you can see, there's been a major shift in that the occupationally acquired look much smaller than the community acquired. And again, this could be a vaccine effect. I think it's still preliminary because it's possible that the cases we haven't adjudicated yet may shift it the other direction, but again, extremely promising news. And so I'll finish again with the point that we shouldn't let our guard down. We really need to continue to wear ice shields, mask, and wash our hands. And just keep remembering that carpooling, social activities with coworkers, working with mild symptoms or sick contacts, and then crowded spaces and break rooms, these are still the target areas for us to be extra vigilant and not let our guard down. And help us continue this decline that we're seeing right now in our cases and in our transmission. So with that, I'll turn it back over to Renee.
Thank you very much, Ralph. And thank you to all of our speakers. I'll now turn it over to Jason Alvarez, Senior Public Information Officer, who will take questions from our viewers. Jason?
Thank you. This one's for George. George, is there any estimation of how many additional cases of COVID are still going undiagnosed?
Well, it's a question that CDC has been trying to grapple with. I think they've way overestimated it. There are at least half are being, I think that's at least half that are undiagnosed because they're asymptomatic and they don't present with anything. My estimate is that 40% of cases are asymptomatic and another 30 are mildly symptomatic. So unless you get caught up in screening or as part of a contact investigation, you're unlikely to get diagnosed. So as a rule of thumb, I double what the case reports are to come up with estimates of the number of people infected.
Thank you. This one's for the vaccine team. Will patients who get specialty care but not primary care be able to access vaccines or UCSF, or are they required to be vaccinated locally or through their primary care provider?
Hi, this is Susan. We will be offering vaccine to all UCSF patients. We are sticking with the CDC and CDPH guidelines, so it will be offered. It's actually being offered currently to 75-year-old patients and above who are patients at UCSF, and we will continue to go down through the list, including all UCSF patients.
Thank you. This one's for Ralph. We have a question about why admin and management are the largest group of infected employees. If they're able to work from home, can you please discuss why they may be infected with COVID?
It's a good question. I don't know. I think, this virus knows no boundaries, and it's possible that that some of the admin management working at home may be in a less protective environment than if they were working on campus. I mean, that's just off the top of my head, but the reality is that we've seen during the last couple of months, especially with off-campus sites, some clusters and outbreaks there, and they were definitely related to group activities and whether there were break rooms or social activities, and that is part of what's been driving those numbers. And so I think, again, re-emphasizing the fact that even if we're not on campus around patients, that we're still at risk for introducing and spreading COVID, and that we need to be.
Thank you. This one is for Renee or the vaccine team. Does UCSF plan to have a mass vaccine clinic with realistic access to communities of color? Who are you working with to establish these kinds of clinics?
I'll let Susan start with this one.
Well, we started a mass vaccine clinic today. We have not yet looked at anything to do with the diversity of the group that was vaccinated today, and we'll need to wait a little bit of time. If the drive-through doesn't work, as we referenced, to make sure that it is equitable access, we are working with a variety of different strategies with Renee and others to make sure that we are inclusive. It's a very high priority for our team.
And those,
feel free to add.
Yeah, I was going to say those strategies include working with Diane Havalier and her group that did testing in the Mission District, for example, and Dr. Kim Rhodes and her group that did testing in East Oakland to see if, in fact, those models could be replicated as sites for mass vaccination as well. Right.
I think the Department of Public Health is going to set up some pop-up clinics in the Mission and Bayview. I don't have any detail on that.
Thank you both. This one is for Dr. Rutherford. Can you speak to the new California variant Cal20C, and do we know if this variant is more or less infectious than the variant B117?
We should have Dr. Chu here, who actually found it and talks about it all the time. So it's a variant that's come up. It's come up fairly frequently here recently, but we really don't have any kind of denominator to understand if it's being transmitted more readily or more rapidly than any other variant is. And I will caution people that as we start to turn the rocks over and start to really genotype viruses, we're going to find lots and lots of variants because mutations, what viruses do.
Thank you. Another question for the vaccine team. We've gotten a lot of questions about whether people will be notified when it's their turn to get the vaccine, or is there some kind of action they need to take? And does it depend on whether they're an employee or a student or a patient?
I can take that. Hi, everybody. This is Gina. So as Susan referenced earlier, we're working through and testing many different options on how we reach out both to our employees and patients. We have settled on what we think the model that we're going to will still be a model via MyChart, but it'll have an opportunity for anybody with MyChart to enter into the scheduling process. However, depending on how you answer the questions, it will decide that it will have a logic structure that will let you either schedule for the group that we're currently vaccinating or not. We know that, there's been a lot of confusion maybe around the different methods that we're using. And this is not atypical for all the other health systems that are doing this, is how do you reach a lot of people equitably through these different mechanisms. So for our UCSF employees, everyone is on MyChart. So it will still be a MyChart, but it may not be via an invitation, and we'll have to communicate out when we are currently vaccinating your cohort so that you can go in at any time and pick a schedule.
Thank you. Another question for the vaccine team. Patients have been asking about a letter from the California Department of Developmental Services that says family members of those with intellectual and developmental disabilities and chronic illnesses count as healthcare workers and are eligible for vaccination in phase 1. How is UCSF responding to this letter?
Yes. So we have, as I referenced before, we have a clinic that we're in partnership with San Francisco City, where we are vaccinating anybody who is a 1A healthcare worker if you live or work in San Francisco. So what we can't do is vaccinate people from other counties. We do have a site that you can access through the city site. It will take you to the UCSF site. Again, you'll go through a series of questions, and then we ask you to bring the proof. And that letter is proof that you meet that requirement as long as you live or work in San Francisco.
Thank you. This one is for George. George, is there data to explain the marked discrepancies in the number of infections between different counties in California?
Oh yeah, there are a lot of data. I mean, it's basically, I mean, the real question is why there's so much disease in Los Angeles. And I'd say they got off to originally, because they went to shelter in place essentially a week after we did, they had a lot more chains of infection established, which they've never really been able to get rid of. And it's been there are large populations of people who have to leave the house and go to work every day. It's just never really been brought under control. And then on top of which, there is probably, I think it's fair to say, there's somewhat more hesitancy around wearing masks in Southern California than there are in the Bay Area, and this has sort of added up to the problems that we're seeing now. Plus, this B.1.1.7 variant may also have something to do with it. Now, having said all that, I think that we're starting to see the turn down in Los Angeles, just like we are in the rest of the state, but that may well be because of naturally acquired immunity.
Thank you. Another question for the vaccine team. How do you assess allergic reactions at the drive-through clinic?
Yeah, hi, this is Susan. So
Do
we
you want me
have,
to-
Yeah, Joe.
go ahead.
Yeah, go ahead. Josh
Would
was
you like me to
there.
take that? Sorry, Jason, I'll fill in because I was actually there today doing exactly this work. So after the patients drive through, they park their cars in a sort of a somewhat organized fashion in a way that we can both monitor them visibly, and then we give them a little bit of counseling about how to reach out to us. We're just circulating around the parking lot, and they can honk their horn. This is a typical pathway in other large vaccination sites that are drive-through. Today we had 2 patients who asked for assistance. Neither one was an allergic reaction. Both recovered nicely, and there were really no consequences.
Thank you. And thank you to all the panelists. And now I'd like to turn it over to Mark Lirrett.
Thanks so much, everybody, and happy Friday. I'll just start by pondering the comments that Dr. Rutherford made about 3,300 deaths a day. It's a staggering toll on our communities, our families, our nation. And I was glad that at the pre-inauguration events that there was a recognition of those 400,000 lives that have been taken away. It's enormously sad. But just as the dark days of winter are giving way to a little more light, still light outside right now, I feel like Dr. Rutherford's slides also show the real potential for us as we start to see a downturn in the surge, the rate of infection and deaths as well. This is a really important moment for us. The vaccine effort has been nothing short of heroic. I was thinking about the fact that we are a very sophisticated, well-oiled healthcare delivery machine that happens to do vaccinations each year for flu, but we've never been set up to do double vaccination over an extended period of time, try to vaccinate an entire community, much less set up and operate mass vaccination clinics. But when UCSF sees a need and a need for our communities, it steps up. It has a long tradition of doing that. And sure enough, here we are. So I cannot adequately thank Susan and Gina and Josh Adler and Sheila Antrim and the countless other people who have worked day and night to get our vaccination clinics up, operating. Our pharmacy team, Desi Kotis, and all who have helped with vaccinations. It's been absolutely amazing. Now, having said that and looking at the questions, there's still an enormous amount of anxiety about when different groups will get their vaccine. And I just want to say that to the extent you can be, please be patient. They are working on it. And as soon as we get more vaccine, we will get it in the arms of people who need it. So again, just huge thanks to the vaccine team. Yesterday at the Board of Regents, Carrie Byington, Executive Vice President for Health for the University of California, talked through the vaccine progress across the entire UC system, which is quite impressive what's being done, whether it's at Petco Park with UC San Diego or across the entire UC system. But one of the things that she highlighted was, again, the fact that we do have great preventive tools. And she actually urged yesterday that we start thinking about double masking. She showed a picture of Tony Fauci, who had a cloth surgical mask underneath a surgical mask underneath a cloth outer mask as a way to be doubly protected. And maybe that's something that we can be adopting as we're in the 100 days of masking that President Biden encouraged us to participate in. But masking, hand washing, and distance, we know those are the three things that will keep COVID at bay. So with that, and again, with deep thanks to all of you, and particularly our vaccine team, thank you so much for what you've done. I wish you all a safe and healthy weekend, and looking forward to the sun getting even a little bit brighter in the sky later in the evening. Thanks, everybody.